Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association. Thank you for joining us today for our Plática called Tenemos Voz. We have a voice on Latino peer recovery. NALBA is a nonprofit organization dedicated to the well-being of Latino individuals, families, and communities in New Mexico and across the nation. Our mission is to address the disparities and barriers affecting the behavioral health of Latinos. Today, we're excited to present our Plática series called Tenemos Voz on Latino peer recovery and the journey of hope and transformation. Plática is the Spanish word for conversation. So today you get to hear a great conversation about the project we'll be presenting here called Connecting Our Voices. As we know, and we're going to highlight our speakers, we're going to have them say a little bit more about themselves to get us started. But before we do that, here's what we'd like to say. We want to thank the Human Services Department for making these Plática series possible, and much credit to the Office of Peer Recovery and Engagement for joining us and hosting these events. And today, we want to say thank you to them for always making such an effort to get information out to communities across New Mexico. Also, this is what you can expect. Our presenters today will be able to share about this program, express their insights, tell us more about the program. They're going to be able to really share how this resource is available to the communities that are being served, and particularly the students who benefit from the prevention program that we'll be talking about. So I'm going to introduce our two speakers, and then I'll tell you more about how the Plática will work. So we're going to start with Jorge Gonzales, and Jorge has worked for NABA for more than a year, and Jorge has served as the program director for Connecting Our Voices, and he shared in his bio that he's worked to communicate and coordinate community health and leadership programs for youth and adults for nearly 2 decades. He has conducted health research on topics that include tobacco use and prevention, as well as underage drinking prevention. He has extensive experience in facilitation of evidence-based programs, which he can help define and tell us more about what does that mean, right? He has extensive experience in experiential education and youth leadership development, as it has also allowed him to travel across other nations and continents. So it's very telling about the extent of his work. Jorge enjoys engaging youth on topics such as social justice, violence prevention, and connecting individuals and organizations to the resources that can make positive change. His years in the nonprofit sector has also included case management and behavioral health, community development, project evaluation, strategic planning, and community development. And in his role as program director for what is a SAMHSA-funded project, he is now very much engaged in delivering what is called a strategic prevention framework and implementing a prevention program. So we want to thank Jorge for being here with us today to share all of that. And joining him is our colleague Cynthia Lentini, who is our program specialist for NABA. She is very much a part of the Strategic Planning Framework project and connecting our voices in that role. Cynthia was the program manager for another project before coming to NABA called RACE. And this was done at the city of Española. So a shout out to the city of Española and folks out in the Española Valley. And she was very much involved with their substance use disorder prevention education that was funded through a New Mexico state agency. Cynthia spends her free time as a community advocate and as an artist. We want to hear all about that when she says more about herself. And she quotes here in her bio, through war, disease, conquest, and colonization, our ancestors lost everything, even our cultural identity. All that is left of them is the DNA I carry. Being the child of an immigrant, she says it drives her passion in being a champion of social justice, diversity, equity, and equality. So you can tell by the bios of our speakers that they really want you to know who they are. And here's what you can expect. We're going to start with the first question. And when we do that, you, the listening audience on Facebook, can ask questions too. So just go into the live Facebook chat make some comments, put your questions in there. We'll make sure the presenters have a chance to react to your comments and questions. And we're going to start with the first question. And Jorge and Cynthia, you have the same question. Tell us a little bit more about yourselves. Who are you guys? I mean, the bio is that much of a window in who you are, but we'd like you to add anything more about sharing, a little bit about your life experiences and what even brings you to this role today. So Jorge, let's start with you, and then we'll go over to Cynthia.
Sure thing, Fred. Thank you. First, I just want to thank the National Latino Behavioral Health Association for allowing Cynthia and I to be here. It's really important. And having a conversation with Fred is like, this is a conversation that needs to happen in a broad spectrum and have open discussion and conversations. And so that's what this whole project is about. But just saying a little bit about myself, thank you for allowing me to be here and the audience too. First off, I want to say my name is Jorge Gonzales. I'm the youngest of 6, 3 brothers and 2 sisters. I say the youngest, but yeah. But I always make sure I try to say that because they're the reason I'm here, for my parents and to my siblings, right? They have made sacrifices, and it is for them that I'm able to do this work, and they helped raise me as well. So always everything, all the thanks I do get to them and to Creator as well. Let's see. So I've been in prevention for many years, as Fred said. That's all the good stuff, but there's even better stuff. I love to be outdoors. I call being the outdoors my green cathedral, because it's where I love to be in the outdoors. And it's my chance to catch my breath and be inspired and to be in connection with all that is. And so I love to be on my mountain bike, sometimes soccer, camping, backpacking. The work that I've done has always been community-based, because I feel that's where my heart is and where I feel called to be. And I've done that in all sectors, in so many sectors, not just here in the United States, but in other parts of the world, working mostly with youth. So a lot of youth development, because as I tell young people when I'm working with them, you're always told by adults that you're the leaders of tomorrow. And I said, that's false. You're the leaders now. You're the leaders of today, right? And so that's why we bring you to the table. Your voice, I always tell them, it's like, your voice is important. I believe that with all my heart and soul. And so we do our best to bring them to the table. And I live here in Albuquerque. I was born and raised in South Texas along the Gulf Coast, but I moved here for undergrad and moved away, and then it just kept calling me back. New Mexico is a beautiful place. Want beautiful people, and so I came back, and here I am. I get a chance to see my family. I'm still connected to my family, and so they're really important to me. So my extended family, and I try to be in touch with them as much as possible, because they make us who we are, and they keep us focused, and they keep us grounded for sure.
Spectacular. Yeah, Jorge. So, in the years that you've been in New Mexico, there's probably a couple of things you like a lot about New Mexico. So what are a couple of those things you really like about New Mexico?
Fred, you always do this to me. You always limit to 2 or 3 things. Whenever you ask me something, it's always 2 or 3. And I have a hard time with that. That's my growing edge. Okay, Fred, definitely. Okay, I'm going with 3, Fred. All right, I'm going with 3. The people, Fred, that's at the top of the list. People are so warm, right? And it's sometimes people are like, they want to get to know you first. They're like, but once they get to know you, you see like their true heart and their true soul, right? And and people, a lot of people who come visit, like, oh, the land is so beautiful. Yeah, that's on my list too. But right, it's the land is a reflection of the people, or maybe they're a reflection of each other to me, right? So, and then Fred, of course, food, right? It's like, I'm getting hungry. It's lunchtime. Maybe that's why it's on the other part of my list. But the food, definitely the green chilies. Green chili. I don't want to get into a battle about red or green, but green chili is on my list. Yeah, and the sunsets, of course.
Yeah, awesome. Well, it's okay to have more than 2 or 3 things. So it's good to know all of that, and it gives a chance to hear more about the things that you love about our beautiful state. Cynthia, well, tell us a little bit more about yourself.
Okay, well, thank you for having me today, and it's a pleasure to speak to everyone. I'm Cynthia Lentini. I'm originally from New York City, born and raised. My parents immigrated from Honduras in the early 1970s, so I'm the first generation born in the States. Um, Being from Brooklyn has definitely helped me to be a bit more open and not so shy when it comes to speaking. After my life in Brooklyn, I was a paralegal before I came into my prevention work. And being a paralegal is very satisfying. I really enjoyed it, but there is nothing more rewarding than the work that I'm doing now and working with our youth here in the Espanola Valley. It's absolutely beautiful, very rewarding. I am also an artist, and northern New Mexico has a way of enhancing that artist spirit, not only because of the amazing scenery around us, but also, as Jorge said, because of the people. Artists embrace one another here. There is that artistic community here that is just so loving and so embracing. So I paint in acrylics, and I also draw in graphite pencil. I am a student for life. I believe in education and always learning new things. So that always excites me. I'm constantly reading, and I inherit that from my wonderful father, who taught me that if you can read, the world is your oyster. There is a book for everything. You can learn whatever you'd like. My parents have instilled in me tremendous resilience, which I'm happy to share with others. And as far as moving to New Mexico, I absolutely love it. Coming from the urban jungle of New York, living in New Mexico, seeing mountains, seeing wildlife. I've never seen a cow up close, so that was really exciting for me. And green chili changed my life. Green chili absolutely changed my life.
Oh my God, that's great. Well, that's true. When green chili hits your bloodstream, it helps to stimulate all the endorphins in your brain. So there's no doubt that it has its magical components. So thank you, Cynthia and Jorge, for sharing a little bit about yourselves. So I'd like to segue to start to learn now about the work you're doing in northern New Mexico. And so Jorge, let's start with you. I'd like you to share with the listening audience a little bit more, and by describing the program called Connecting Our Voices, and who do you serve, and where is this program, and what are the program goals? And so let's start with that, and then we're gonna, of course, tandem with the two of you with questions. But Jorge, just kind of help us frame this for the listening audience. Go ahead, sir.
Absolutely, Fred. Thanks. Connecting Our Voices is a project in northern Santa Fe County and southern Rio Arriba County. That's of northern New Mexico. We're in our fourth year of this project. I've been in substance use disorder prevention since the early 2000s. Fred and I go way back, this is an issue that faces this part of the substance use is an issue that has faced this part of the state since for years, right? And this project specific is federally funded by the Substance Abuse and Mental Health Services Administration, and also local grants as well, such as the Conalma Health Foundation. So I just want to thank them for the support they have, because they see the great need. But also the social capital, the strength that exists there. And so Connecting Our Voices is a project we received funding in 2019 from the federal government, and it's to serve this area. And what it is to delay the first use of substance use, change community norms around substance use, and also to create bonds between young people and their community. So whether that's with an adult, their school, or their community, because that is a protective factor, right? As part of prevention, young people need a protective factor, and those bonds are protective factors, right? This project is called Connecting Our Voices, and the way it looks, it's community driven, right? We do have our goals that are handed down to us from the feds, but what that looks like is led by the community voice, right? Because it's important that we have community voice and participation, and making sure looking at who's at the table, right? And so that because we don't always have the answers, right? And so it's important that the community, the local experts are here, right? And at the table and talking about, this is what we need, this is what we see happening. And so they guide us in there, in what the project is going to look like. So when it first started, is like, we have to bring a group of people together, a work group. And they decided that the name was going to be Connecting Our Voices, right? Because it's a Connecting Our Voices work group, because they want their voices to be going to take action, right? It's not just talk for everyone. They know what their community is like, and they're like, no more just talking. It's like, we need to take action, right? And so I just want to show that. This is the logo, right? I think we can see that. It's Connecting Our Voices. It's a beautiful flower. Cynthia created that, put the t-shirt together. The design is by Diego Lopez, who's born and raised in Española, a local artist, but he's also in prevention. And as he came to the table, he listened to what people had to say, and said, this is an opportunity for us to grow together and to bloom, right? And that's what this project is about. It's like, how do we work together as a community? And so that's community driven. Also bringing young people to the table. And so some of the things that we have implemented is a school-based curriculum. It's called Familia Adelante, created by Dr. Cervantes, but it's been adapted for northern New Mexico. And so here it's families moving forward, because as some of you may know, we have a rich culture here and different ethnicities and groups. And so we want to be inclusive of people. So there's been adaptations to that program, and it's called an evidence-based program. It's because this program that teaches social emotional learning has been proven to work and has been replicated. So those are the kinds of things, and that's what Cynthia is a facilitator with that. And so the other part of that is that we're working on a youth advisory council, because youth voices is important too, right? Again, with them, working on this with them, and so they guide us, and youth have a pulse on their community as well, and their peers, right? And so they let us know what is happening. And so also we have paid youth interns, right? Is that I've been in prevention work for years, and we've paid young people with, oh, we're going to feed you, we're going to give you pizza, we're going to give you cookies, we're going to give you drinks, right? But now it's like we need to have a paradigm shift. It's like, your voice is important, your presence is important, and we value that. It's like, we're going to do what we can to pay you, right? A reasonable wage for that. And so we've been able to do that through some of our funders. And so they help guide the project as well. So Cynthia can talk a little bit more about that, but the youth interns has had great success. We started that last year with 6 interns, teenage interns, and providing them trainings and such things as social media and messaging, things about how to use data, because that's other part of this project, is that we know our priorities because our project is driven by data. This is what we know is happening in the community that's been gathered by the Department of Health, the Center for Disease Control, SAMHSA. So we collect that, and local data too, community surveys, like what are people telling us? And so so those are different things that the young people are doing, and how they can learn to advocate. So meeting their legislators, meeting their governor, right? Because so they can advocate for what the needs are. Because we've noticed, and Cynthia will attest to this, that policymakers, their ears perk up. It's like, oh, there's a youth in my office. They will end the meeting with whoever's in there with them and come right out and meet the young people, because that's important to them. And so it's giving the young people those skills, right? And hopefully also gives them an opportunity as well to meet and to do things that they have never done before. And it's great. Like, maybe one day they become those politicians or those advocates, or enter the behavioral health field, because we're really, like, especially the young women we have now as interns, we're looking at more BIPOC, Black, Indigenous, people of color, to be in the field of behavioral health services, so that if I'm seeking behavioral health services, then I walk into an office, it feels better to walk into an office to someone who looks like me, right? And that was the way with my mother, whose first language was Spanish. When she walked into a doctor, she felt more comfortable to speak to someone who's in Spanish and someone who spoke Spanish back to her. So that's how where it is, and that in a nutshell. So if you have any follow-up questions,
Awesome.
here, yeah.
Awesome. Well, thank you, Jorge, for summarizing in a very enthusiastic fashion, what is dynamic about this particular population that you're serving, the youth in particular. And so thank you for describing all of that. I want Cynthia to know that a colleague has said she made a quote of the day, and the quote of the day is "Green chili changed my life." So I think you may eventually have an autobiography in the works, because as we know, food is medicine, right? And the work that you're doing as a preventionist is medicine, right? So we're going to turn over to Cynthia an opportunity to describe, in her role as the facilitator for these youth groups, what that experience is like, right, for the students and for herself, and how is it that the students react to these sessions, and then more important is what is it that the students are learning to reduce the stressors that affect their life that pertain very much to how to reduce and try to deal with the onset of substance use, right? So as a prevention program, ultimately the goals are to do that, right? Is to prevent the use of substances. But to do that, you have a curriculum that addresses these stressors. So kind of walk the listening audience through that process. What is that dynamic like? What is that content like? Just so that someone can envision it, so that in case they want to make a referral to you all, they would know what's happening inside those sessions, right? So that there's at least a general framework for that. So Cynthia, if you could just kind of, put us inside that space, that'd be great.
Okay. Being a facilitator of this program is unbelievably rewarding, considering what our students are facing, what our youth are facing in the community. We needed a realistic approach to speak with them, and to speak with them with courtesy and respect for what they've gone through. They have seen a lot more than we would like for them to have seen at their young ages. They have suffered vicarious trauma or direct trauma due to substance abuse within their families, within their communities. And what I like to tell my students is, we've all seen it, even if it's not at home with us. We see it when we go to shopping. We see people on the street. We see people suffering. We hear it from our friends, family. So we all face it. And that's the first reality we deal with, is that we're all facing it. And we all have this commonality of being survivors. We're all resilient. And it's one thing that I love to point out in our sessions is that New Mexico, this is such a resilient community. The communities, the people of New Mexico have survived a significant amount of changes over centuries, and it's in their blood, it's in their DNA to survive. So that's one of the first things we focus on, is making it a positive. Like, you're a survivor. These are just events in life that help mold us, but they don't define us. Next, we talk about stresses that they're exposed to: family stress, school stress, acculturation stress. How do we just get into a middle school after being in elementary school? Now we're in middle school, things have completely changed. The dynamic is different. I'm seeing students from other places that I've never met before. All of this on top of whatever they may already be dealing with at home or personally. We talk about those things. We talk about those realities. We talk about positive coping mechanisms, alternatives to facing our emotions, to dealing with our feelings, to acknowledging them, accepting the fact that every emotion is normal. We're human. We're designed that way. We're designed to go through every emotion. We just aren't designed to always properly deal with them and express them correctly. And that's what we try to focus on. What we found is that usually our more challenging students are the ones that we want to focus on the most, the ones that actually need the most out of this program, because we know they're already facing something. And it's been amazing to see the changes, to hear these voices, who maybe at first weren't kind of into it. They weren't so sure, oh, this is boring, or they wanted to act out. But then getting to that 5th or 6th class, and suddenly they're engaged and they're participating and they're raising their hand, or they're stopping me after class to ask me questions because I've hit the nail on the head on something and that they can relate to. And that's also a really important part of facilitating, is that I've taken the time. Jorge has been in the area a very long time. I'm new, relatively new. I've lived here for about 6 years, but I've taken the time to really get to know the community, to get involved, to see what it is that's out there, what our culture brings. It's an amazing place. So that's another thing that we use as one of those protective factors, is to remind our students, we come from this beautifully rich, artistic background. All of this is right here at our fingertips. Just yesterday, we were talking about 10,000-year-old petroglyphs that are within a 25-mile radius here. So there's just all this strength and resiliency to be drawn out of this community. And the youth, they show it every day. They show that resiliency, they show that ambition. I think giving them those positive coping mechanisms helps them to vocalize, because more than anything, not only do we want them to use their voice, to recognize it, to have it, but use it appropriately, because there are challenges in getting folks to listen. And if we automatically go with anger or obstinance, our message gets lost. So that's another part of it that we really go into explaining to them, is let's talk to each other with kindness, respect, and courtesy, because that gets us way more and allows people to be willing to speak with us and compromise with us.
Wow, super. You're putting us in that space, right, of what it's like to feel as students that they're part of the dialogue in a very significant way, right? Because they're telling their story, they're expressing these things from their vantage point. And it was great that you kind of factored in the fact that culture plays a very significant role, right? Because the students come from different cultural backgrounds, right? In northern New Mexico, those particular cultural groups are very well known, right? I mean, we're very knowledgeable about the differences of our cultures and how it plays a role in the curriculum. And so when you think about the groups that you've had, what more can you say about the groups of students that are yet to come? I mean, what are some of the plans in place for serving more youth, and what will that look like, and where will this happen? So that this way, folks can say, so this is happening at the schools, right? Or is it happening out in the community? Just kind of zoom in, right? So where is that taking place? Inside the school settings, community settings? How does that work, and what groups are yet to come?
Sure, I think Cynthia and I could tag team this. Did you want to start, Cynthia?
Sure. Right now, we are partnering with the Española Public Schools. So that's where we're located. We are looking to expand our capacity so that we can be in more schools and offering more of this information. We make a presence at local events just so people can know what we're doing and why we're here. Connecting Our Voices, which is our community work group. We have brought together almost 30 community members in our last meeting, and we spread the word through that as well, knowing that we're always available. We are tossing around ideas on expanding our outreach within the community, and not just maybe in the school setting, but more of a community setting. And we've talked about maybe going with a younger age group, like in elementary school, because I think it's never too early to start prevention work, especially with the obstacles that we're facing now because of the fentanyl pandemic. I think we absolutely need to get started early. And again, I'll say, like, our children, our youth are far more aware than we like to acknowledge sometimes. They are very much aware of these issues and these social issues, and they want to be a part of the positive change. So the more we can get out there, the better. And I'll leave it to Jorge now to explain how we're going to expand that.
Sure. Yeah. That was it, Cynthia. It's like, yeah, our vision is like, not just our vision, but the need is, right? The community has told us, is like, we want you in our schools, or we need the schools. So right now we are in Española Public Schools, in the middle school, right? But there are 11 elementary schools that feed into one middle school in Española, right? That's a great number of students. And so what we see is like, we need to start them early. Conversations within our work group, within our core team. It's like, we need to start them early. It's like, we're in the middle school. We need to start we need to start it earlier in elementary school and then follow up in middle school as well. So elementary and then middle school. That's what it's like. But also there's a lot of rural communities that don't receive as many services, right? So that's what we're looking into. In just that catchment area, like I said at the beginning, it's northern Santa Fe County, southern Rio Arriba County. So we want to be in more schools, absolutely. And people have requested that. Right, and so that's how what we're doing is like we're building capacity, like giving people the skills to be facilitators, young people as well the skills, right? Building up that new workforce, right? Hopefully, right? And but we're looking at different foundations and federal funding because that's where it happens too, right? How do you sustain this program, right? We sustain it through the people who are in our work group, right? But also we other need that they are a resource, but we also need like financial resources. And so, yeah, so those are things that we're looking into so that we can be in other middle schools and other elementary schools. That's what we do, is that we're in schools, but that's where the curriculum is families moving forward. And Cynthia said, yes, we want to be maybe even in other groups as well, but we also have our interns and our youth advisory council. So if you know of young people, please reach out to us, and we can provide our contact information before we're done on the Platica. But that's what we want to do. We want to bring young people in, and also staff, right? We need to build capacity. We need more facilitators like Cynthia, right? What we have seen is funding decrease. And so what that means is that there are less people in the prevention workforce. So that's the other goal that we're trying to build as far as the bigger project is to build a capacity. So we're bringing more people back into the prevention field because it's necessary, and it does work, right? We do pre and post surveys and with the students, right, after the curriculum, before and after, and we see that there is change. We've done pre and post with the intern as well, that this works. Right? This is evident. This is what evidence-based is. Changing community norms and other work that we're going to be doing in the bigger picture is what the youth interns are going to be doing is like things like this. We want them to speak on Platica. We want them to be on other social media so that they can send messages to their peers. Right? Like not everyone uses, right? Sometimes they hear the words like, oh, everyone's using. It's like, no, that's not true. Right? There are high numbers, but there are a lot of young people who don't use, and how they support each other, how to prevent violence, how do they stand up for each other and be active bystanders. So we want to do that in more than just schools. And so we're looking at how to make that happen. Also, if you're interested in joining Connecting Our Voices work group, we're meeting tomorrow. We meet every fourth Thursday of the month from 2 to 4 p.m. Mountain Time. So that's either on Zoom, if you're able to make it on Zoom, or if you're able to make it in person, we're in Española. So let me know if you're able to make that, then we can send you a Zoom link, or we can send you the information of where that's going to be. Yeah, so we need your voice.
I appreciate that. And so here's what we do when we hear that. What we do is then we put a contact information in the live Facebook chat. So this way people know what number to call, what number to text, what email address to write to, and if you want to also include a website, that all that information, if you can share that with the listening audience, then they would know how to get connected, because it all leads ultimately to something you're all talking about, is being able to serve the children in our communities, given that the issues are well known, they're well documented, but what's important is the opportunity you're bringing to the communities, right? So if somebody wanted to make a referral to you all for their child, for instance, right, who would be of the age, how would a person proceed with making a referral to Connecting Our Voices? How do you connect to community? So tell us about how a parent, let's say I'm a parent, I have a teenage boy, and I realize that what's happening is that he's struggling with the pressure to try smoking marijuana, or his buddies are trying to entice him to stay a little longer after school so they can try out something that's going to be an illicit drug, right? And so, that pressure can be really difficult, right? But he's candid enough to tell me as the parent, gosh, they're really making it hard on me because they're saying, if I don't do that, man, I can't hang out with my bros, my friends, right? So how does a parent connect with connecting our voices?
I think Cynthia and I will tag team this again, because she has a lot to say about that because she's more on the ground in the schools. But what I can say is that if a young person approaches you, as an adult with that, bravo, that's great, because that's what needs to happen. And Fred, you hit it right on. It's like open dialogue. That's what needs to happen between adults and young people. Because what we also have seen is that we see a lot of grandparents raising their grandchildren, right? And there isn't a handbook that says this is what needs to happen. And that's the other thing we're trying to do is like, now we want to start having information sessions for parents, caregivers, guardians, whoever's raising the young people in the house, right? Give them the skills, like, because I don't have any children, but I've worked with children for years. But what I've been told is like there isn't a handbook that drops out of the sky on how to raise them, right? So how do we support each other as a community and being there for each other? So if a young person approaches you, have that conversation. Don't shy away. Look for resources. Talk to the school counselor, school social worker, right? Those are services that exist within your school. The school-based health centers exist. I don't know if that's in every school, but there are schools that have that, right? If you don't have the knowledge, seek out that knowledge. Do internet searches on SAMHSA, the Substance Use and Mental Health Services Administration. There are toolkits on there. And I would like to do another Platica in the future and talk about that toolkit, about having those conversations. And we can do that. That's why this is a great venue for that. And so that's what we're trying to do to make those conversations happen. Because I just want to share something about data, right? I've been talking about data. We did a community survey with almost 200 high school students and in this area. And when we asked this, when you think of your family, what are the most inspiring images in your mind? You know what young people said? One of their top answers, family bonds and role models. So if you as an adult, if you're listening to us there, you're thinking, oh, my child is not going to listen to me. Guess what they are? They may be rolling their eyes, right? They may be rolling their eyes, or they may be like, they're really listening to you. And that's what that's what young people are telling us. Like, they're really listening. That's a protective factor, to have those conversations with your young person. Who are you with? You're on social media? Who are you in touch with? Like, what are people in your young people in your school saying about substances, right? Start to gather the facts, and us as a resource, we can link you to those resources as well. So those are important conversations to be having, because young people are saying like many of them are saying you are influential in their decisions that they make. So Cynthia, if you're going to answer the other part about that.
Well, I think one of the great things that we've been able to pull together is that we've gotten all of these local resources together. So when we speak to our youth and we tell them, know your resources, know what's out there for you. We're talking about us, the everyday people that are gathering together, making phone calls to one another, sending emails. Okay, I had a youth talk to me about this today, and I can't help with that, but what about you? And creating this full wraparound support for our youth. That's what connecting our voices is for, is so we can provide those full wraparound services within our community from our community members. We are really making it literal that it takes that village to raise a child, and we want to be that village and offer support to our village. Because so many grandparents and kin are raising children because their parents aren't able to do it due to a variety of reasons, we also want to provide that support, because it is hard. I know at my age, I'm grandma age, but if I had to start over, I think I'd have a really hard time with the social media age youth and raising someone full time. So we know that there are gaps there that we try to fill and try to assist with. As far as parents wanting to know more about our program here in Espanola, I would say talk to the Espanola Valley School System. The superintendent's office, let them know that you would like your child to be in this program, that you would like that program available within your child's school. That will certainly help us get that capacity building going and get into more schools. Contact Jorge or myself. We are so happy to talk about this program. We can spend hours talking about it and the efforts that go into it. And we do know that there is a direct impact of focusing, doing prevention work and focusing on education and future employment, because those goals that we help our students set will actually give them something to focus on through their youth so that they know that they can move into something better when they reach adulthood and all of those decisions are within their own power. We also know that with adults, that works in recovery. So that also gives our students a chance to understand, like, we can help so many people. It's not just about stopping before addiction begins, but how do we modify it? How do we work after someone has gone through recovery? How do we get our community back? And how do we give people back their voices and their dignity?
That's very powerful. That's absolutely right. Yeah, go ahead.
Well, Fred, I was just looking in the chat, and a person I mentioned earlier, Diego Joaquin Lopez, who created the design for Connecting Our Voices, who born and raised in Espanola, and he's on our core team, right? And it's important, like when we talk about being culturally competent, being more culturally competent and more culturally aware, it's like having him a part of the team is like he has been there forever. He guides us, right? His voice, he knows the community so well. He knows the risk and protective factors that exist. He is a senior prevention specialist. He's been in the field also for, well, I'll let him say that, but it's true. And having people on our team, right, it's important because as Fred and Diego know, is like we've been in prevention field for quite a long time, and we have seen funds diminish. And so Veronica Moreno has said, how can we support the teens that you serve? Have those conversations with those young people in your family. If they're not asking you, you go to them, right? That's how you can support them. It's like, what do you know about this? Or what's happening in your school? Or what have you heard about this? It's like, don't wait. Have those conversations now. It might be hard, but look for the resources. But also one of the biggest things is that speak to the policymakers, to those legislators, right? If we keep silent, the funds will not come, right? They need to know like what is happening. They're not on the ground. They're not like they may have children, but like they may not know what's happening, right? So call them, send them emails, send them letters, knock on their door. It's like that's what our youth interns are doing, right? They met the governor and some of their local legislators, Senator Leo Jaramillo, and that's what people need to hear. Is like, what is happening? And have them learn about, or having them learn about what are bills that are there. Do the same. Like, what are bills that are happening, or just say, we need this in our school. And Fred, you're asking how do we get people more involved? It's like, that's the way. It's like, call the policymakers, because we're the ones that put them in office, right? And so they should be able to spend that time to listen to us and what they can to support the services that need that, because a lot of times it does come with financial, but also there are in-kind things. We work with an organization who allows us to have meetings there, right? That's an in-kind, right? They allow our teens to meet there, right? To use their internet, also for our Connecting Our Voices to meet. So there are a lot of different ways that you can contribute. Like, you may not have the financial resource. There are other ways that people can take part and to be an active member in prevention work.
And I just want to add
Awesome.
to that. We can always find a way to help, especially in our community, because of our rich culture. If you're an artist, mentor a child, mentor youth. If you know about raising culturally appropriate crops here in northern New Mexico, offer to mentor some youth and teach them about that. That's the greatest gift we can give them. And our partner, Diego Lopez, is working with another group, the Boys and Girls Club, and they're putting together lowrider bikes because the lowriders are such a huge part of our community here. So these are the things that we really need our community to get on board with, is help us provide our youth those alternatives and to teach them about the richness of our community and our culture.
Well, thank you both for making a shout out to our colleague, right? Our collaborator, Diego Lopez, right? And you're absolutely right. If you know Diego's family, right? His dad has been a santero for most of his career and his life, and he has been such an influence there in the valley because his family of origin, like many of the families in northern New Mexico, have been there for hundreds of years, right? And so you talk about generations, and thank you for the shout out to our colleagues who commented on the Facebook page, because in part, they're both already making contributions to this entire effort, right? Both as collaborators and as interested parties, and all of that is connecting our voices and connecting the community, because sometimes what happens in communities, there are disconnects, things that start to break apart some of the things of the past, traditions, culture, customs that are starting to diminish or waver. And so this is an opportunity to ensure that the community's history, its culture, its richness, right? Because we're talking both about the Native American community, we're talking about the Latino community in particular, because it's the significant highest percentage of the population, and all of our other cohort groups that are in the Valley, right? We have many families, who have been in the Valley for a very long time, for generations, that are not from Latino or Native American communities. And so this is the opportunity to reconnect the community as well. So connecting the voices, connecting the community, and you're being conduits to that's really important. So this has been just great. You can tell that our listening audience is going to benefit tremendously from hearing this live session, but then we want to make sure folks can continue to comment on this exchange, right? Even after today, they can still type in there and say, here's my email address. Can you reach out to me? Or what can I do? And thank you all for putting in your email address and your phone number here, because part of connecting to resources is, as you're all recommending, is engage, communicate, talk to us, reach out to us, right? Because that connectivity is in fact how communities engage with each other, right? We're responding to situations that are challenging families and the circumstances that have been happening for many, many decades, right? So the prevention efforts that this program is doing is really help to mitigate those conditions and circumstances that are happening. And so there's a couple of things that I'd like you to share, because these are resources, right? We want to acknowledge and give credit to United Healthcare for supporting Connecting Our Voices. And Jorge can tell folks a little bit about that resources and what's up in store for things to come. And Cynthia, maybe you can say a little bit more about the upcoming event with the other projects there in northern New Mexico coming up soon. So if you can share those resources, this is
Sure.
another way to communicate this out there. So go ahead.
Great, thanks, Fred. Yeah, that's right. The United Healthcare is also fund this project, right? So that we can be in more schools, right? The United Healthcare been generous and having great conversations with them, and they're helping us put together a video about this project, so that we can put that on social media, because that's important too, right? Things like this that like young people doing this, and also what this work is about. So we're working on that with United Healthcare. So thank you so much to them as well. The Continuum Health Foundation, which is in northern New Mexico as well, and SAMHSA is our funders. So all of those contribute in different ways. So again, one of those ways is like contributing to, if you're able to, contributing to the organization or a foundation that that the work that is happening. I'll also put into the chat a community assessment report that we use, and I referred to it earlier about what young people with those 200 youth that were interviewed, and a community survey. So, but there's also data in there about the 2 counties, the state of New Mexico, and also compared to the USA as far as substance use, and all those other factors that contribute, health issues that contribute. and the reason that exists is, like I said, we're data driven, and so we're making sure that we're on the right track. So that's why we bring people to the table, but also looking at data, making sure that we're on the right track, where the gaps in services are and where our focus needs to be. And so I'll put that in the chat. We update that annually. And so I'll put that in the chat, and about collaboration too. It's like we don't want this to be on a virtual shelf. This is on our website. So if you feel like I'm going to apply for a grant, my organization is going to apply for a grant, here is data. We shared that with the Escondido Police Department. We shared that with our work group, so that when they're seeking funding, that they can use that data, because it's important. A lot of work went into that, and it shouldn't just sit on the virtual shelf. It can be used, and we share that with our school district. That's important too, because they want to know the work that's being done, and so bringing them to the table and sharing that with as well. So the data we share, right? And that's really important when you bring people to the table, is like sharing that information. So I'll put that in the chat in just a bit.
Great. Cynthia?
Okay, our work continues. We are just so excited about what we're doing and expanding this model within our area. Wonderful partners to work with, and knowing that we have all these resources available to pull together for our entire community is just an amazing feeling. What we'd like to focus on is not only expanding our capacity, but actually putting together events within the community and working with our partners on those events. Hands Across Cultures is one of those partners, and they will be putting together a resource summit later this summer for the youth. And for the families in the community to know what resources are available to them, and to hear from our voices what we can do for them. So those are one of the events that we're really excited about being a part of. Our youth interns, I wanted to give them a quick shout out to Kayla and Amberlynn, because they are so integral in this process. We already have them looking into what they're going to be working on to pull this youth summit together. They're now familiar faces at our state capitol at the Roundhouse. They've met with Leo Jaramillo, they've met our governor, they've met with our governor's advisory board. It's just been an amazing experience for these young ladies. And I would love to share that with every youth I can, is to expose them to those experiences, for them to know that we're just people. It doesn't matter what our title is or where our office is located. We're here, we're listening. We want to know what you need. And to quote a student that I spoke with on Monday, who is only 11 years old, what you grown-ups decide on is what we have to fix later. So get it right the first time. So that is what I'm encouraging everyone to think about, okay? Because our youth are aware of the decisions that we're making on their behalf, and they want us to do it right, because they don't want to fix it later. They don't want to have to deal with the fallout of our bad decision making. So please keep that in mind.
Thank you very much for sharing that. Well, I can't believe we're 7 minutes from concluding today's Platica, right? So as Cynthia said, yeah, we could very easily have this exchange in 2 hours. And even then, it's only just really to excite and incite action, right? I think what distinguishes this particular prevention program, right, and the effort is it's very action oriented, right? Because if you think about the challenges in front of our communities, which they're vast, at the end of the day, what determines whether or not you're successful is whether you did something for the people you did help. So we know that for every youth that participates in this program, right, the outcome is it will help them to be able to learn what it will do to reduce the onset of consumption of illicit drugs or other types of drugs. So it has a considerable impact in their lives, right? Because the brain development of youth still continues into the early 20s. So what ends up happening is that any of the influences that have been detrimental to their health and well-being is the kind of thing that the participants can benefit from. So, right, so we're serving 100 students. Imagine if you served 1,000 students. Imagine if you served all the students in the entire school district, right? All of that means is that every effort that goes into preventing the onset of substance use is going to reduce the likelihood of people having to be in treatment or have to move into recovery as adults, right? Because what happens is you begin the process now to protect them and to shield them from the negative influences and risk factors. So this has been a great chance to hear about connecting our voices, and we want to encourage all of you that are listening in today to please add more to the chat today and for the recorded version that will go up here in very quick order. So one of the things we'd like to do is make sure that as we wrap up is, what is one takeaway for the audience that you'd like to make sure that people heard today, right? Because oftentimes, as much information as it is shared, questions, oh, okay, what was it that I really am taking away from today? So I'm going to ask each one of you to do a little takeaway for the audience that you really want them to hone in on this. And then that means it's like a homework assignment, right? Is we want you to take this with you because there's some reciprocity, right? Como decimos en Nuevo Mexico, as we say in New Mexico, que una mano lava la otra y las dos lavan la cara, right? One hand washes the other, both wash the face. In New Mexico, the value of reciprocity is that it's a give and take. We're sharing, we're helping and supporting each other. It's the mutual aid approach to doing what? Offering us helpers and healers something that will help and heal their circumstances. So Jorge, if you could, and then over to Cynthia, and then we're going to wrap up.
Okay, thanks for it, and thanks for giving us this opportunity, and also to our last thoughts. Speak to your representatives, speak to your congressperson, speak to the policymakers, right? That's important. There needs to be more funding for these preventive services that are proven to work, right? That's what they need to hear, and collect data. That's why one of that assessment report, epidemiological and assessment report exists, is so that you can look at the highlights. This is the resiliency, the strength of this community, but this is where the struggles are, and this is why we need this funding. So that's important. So whatever capacity, that's something, right? That's what you can do. Write a letter, send an email, send a text. So all those things on their social media pages, those are ways to reach them. That's absolutely the way. And then one other thing is, if there's a young person in your life, right, speak to them about substance, ask questions, know what's happening in their life, right, and have this conversation. Have you used, right? And Fred, you brought up a good point about brain development. The human brain doesn't develops until the age of 25. So if you introduce alcohol, tobacco, marijuana, or other things like that, that affects the development of the brain, right? States of, marijuana has become legal for adults in many states, right? And so what is the message we're sending young people? It's like, have the conversation with, like, not to use, right? And the reasons for that about brain development and why that's important, and dialogue, right? It's dialogue. It's not just as an adult talking down. Like, and Cynthia brought this up, that they have a lot to say, and I think that's what dialogue is about, having those conversations with them, knowing that you care and you love them, right?
Awesome. Very powerful. But, as you said, great points, right? That advocacy is within your power, right? And so it's really reinforcing the power that we all possess. You're encouraging it because people don't need anybody's permission to do that. So in part, that's a powerful message, is how to advocate. And then really a very practical tip, right, is because communication in our families is a very informal process, right? You don't have parliamentary procedures that you have to follow when you talk to your grandma, what you have is just the usual plática, right? The discussions that we have in our family. And it's good to talk about the risk factors, because what happens is it's the very thing that takes our kids' lives. And if families are the number one value in Latino families, that means we back it up, right? We back it up we address the stuff that harms our kids. So great tips. So Cynthia, what's a takeaway that you want to make sure people really leave with today? Because obviously, besides your quote, green chili saved my life. Besides that one, all I could say, that should go on the T-shirt in the back of that logo now, because part of that is that's absolutely right. There's a term that we've used in the Chicano movement, came from the Chicano movement. I want you to know. So this predates your date of birth, possibly, right? This is a very late 60s, by the way, and it's La Cultura Cura, right? So that expression popularized because part of that is that all the aspects about our protective factors in our culture are the very things to protect and mitigate the risk factors. So, Cynthia, what's one takeaway you want to have for today?
Find our voices and use them. Don't take no for an answer. When we need to speak to people about the needs, speak to your city council, speak to your city government, speak to your county government. Don't just start with our senators and our governor. It starts from the ground up. So start with our basic foundations. There is a lot of money that is going out right now through opioid settlement funds. Speak to your local leaders. Those funds need to be used for prevention and recovery. I cannot express this enough. So please make those phone calls, write those emails, write those letters, go to their offices, but make your point clear and make it heard, and don't take no for an answer, because that's the easy way out. Anything worth doing is going to be worth struggling for and worth putting your voice out there for, and this is definitely worth it.
That's absolutely right. So with that, we have reached the end of today's Platica, but the message, of course, is que tenemos voz. We have a voice. Right. And so as we have a voice in this Platica, we want to be able to take the advice from our colleagues, our cohorts. Thank you, Jorge and Cynthia, for being here with us today. And to those of you who did have a chance to listen in today, please share this recorded version with your comadres, with your abuelitos, right? And share this with your kids, right? Because in part of that, it's a way of kicking off that conversation. So again, muchísimas gracias. Many thanks to all of you for being here with us today. And to those who listen in every month, we look forward to seeing you at the next Platica. Muchísimas gracias. Many thanks. Take care.
Bye-bye. Thank you.